Hello, I'm Dr. Ralph Atanasi, President of the Florida Dental Association, and I'm here with my friend and colleague, Dr. Karen Glerum. Karen, thank you for joining us here today. I would like to ask you a few questions. Were you treated in a certain way by patients because you were a woman dentist?
Yes, I find for the most part that patients are extremely accepting of women in dentistry. Patients have the overall perception that we as women dentists are more caring, we are gentler, we are better listeners than our male counterparts, and that does give us a little edge on those male dentist counterparts that we have. I don't know if that's true for women dentists in general, but I do try to live up to that perception. I think it's very important that we do fulfill the perceptions that patients have of us.
Were you treated differently by your peers?
Yes, well, let me say I'm accepted and valued as a member of our local dental profession. It wasn't always the case when I was a young woman dentist. I had 2 incidents of discrimination because I was a dentist, or woman dentist. I had one incident in which I was working as an associate, and the owner dentist wanted me to have the same uniform as the rest of the staff and not a uniform as a doctor. I had another incident in which an owner dentist felt I wouldn't make a good partner because I was a wife and a young mother. I really hope that those incidents are not occurring anymore, and I hope that organized dentistry is somewhat of an advocate to prevent those incidents from happening anymore.
Do you feel you'd like to mentor other women dentists? And if so, how?
I would love to mentor other women dentists. I think women especially tend to stand back and take advice, even if it's unwarranted advice or unsolicited advice. And women need to learn to listen to their own voices. They need to learn to speak up more, and I think that women who have been in the profession, as I have for some time, can help to mentor those younger women to become more outspoken and more of their own advocate.
Can you give us a little insight into your management style?
Well, I believe I have a small office, and I believe that my team, wonderful as they are, would say that I'm a very hands-on manager. I act as my own office manager, and whenever there's an issue at the office, we sit down immediately, we discuss it, and I feel I'm very, very caring as a boss, as an employer, but I can make the tough decisions when I need to do so.
When did you realize you wanted to be a leader in dentistry?
I've had an interest in organized dentistry ever since 1982, when I joined the American Student Dental Association as a dental student at Georgetown. I really enjoyed my involvement with ASDA, and I continued that through my early career. I think it's so vital for us to have our voice in Tallahassee and in Washington, and if we don't have a vibrant and very active association, we were not going to be a vibrant association or a vibrant profession in the future.
Do you feel that this is a generational issue?
Yes, I think that there is, among younger dentists in their 20s and 30s, there might be more reticence to join the dental associations and to get out there and go to the meetings and meet people. I think this is just because we're such a cyber age at this point that most of the younger folks feel they can get everything they need online or without actually showing up. That's a real fallacy. There's nothing like being present at a meeting, and there's nothing like meeting your colleagues. That's so vital.
As a parent of 2 young women, can you please tell us what's your secret?
That's a great question. I don't know if there's any true secret. My daughters, Alexandra and Natalie, I'm extremely proud of both of them. And they both had their moments in the past. I think the secret, more or less, is having a close family and having very good family values, as everyone talks about, and having good backup. We want to also involve grandparents and aunts and uncles. And I also feel that my children saw me as a professional, not only as mom, but they saw me as a dentist and mom, and I hope that they will appreciate that.
How do you see dentistry in the next 10 years?
Well, I think it's going to be very exciting. Our profession has a lot of new procedures and new techniques coming around that we're starting to experiment with. Not only that, but we're attracting really, really educated and vibrant people to join our profession. So I have a lot of hope that these young people will take over where we left off and continue our profession of, we're a prevention profession, and I think that needs to be continued, and hopefully they will do so.
Well, that's great. We wish you and your daughters much success in the future. Thank you for joining us.